Welcome to Sculpted and Unscripted with Dr. Azad, where we answer the most common questions about consultations, surgery, and recovery. Honest and without the script.
Hi everyone, welcome to another episode of Sculpted and Unscripted. Hope everyone had a great weekend. I certainly did. We went to the Preservé training and I'm going to tell you all about Preservé today.
How was your trip?
Oh yeah, the trip actually was amazing. So there was like 24 of us from the US that was invited to go to Costa Rica to get trained in the Preservé. We actually got there. It was like a 3-day trip. It was Thursday night. It was just a dinner. It was just meet and greet with all the other surgeons. It was actually cool. We met a lot of cool surgeons, and they were from all over countries. A lot from California, obviously, but from Georgia, and there was one from Panama City. Where is Panama City? Is in the state of Florida.
In the Panhandle, right? Yeah,
oh,
the Panhandle of Florida.
I didn't know. It was a super cool guy. Anyway, so that first night we just kind of was like a meet and greet with the other surgeons. And then on the next day, Friday, they give us a scrub, the Motiva scrub. It was nice. And then we went to the medical center, and it was like an educational course for that whole day. So they tell us about the inception of Motiva, how it started, the comparison to other implants, and then they show us a video specifically for Preservé, how to do the surgery. And then there was this. It's actually kind of funny because there was a workshop, and they said, "Oh, you guys gonna mark the procedure?" Because the marking in Preservé is very, very important. It's one of the biggest portion of the case is actually how to mark the patient. So it's very different than the traditional marking when we do for breast aug. We just make an incision and kind of outline the pocket. This one is very involved.
Yeah.
So they told us like, "You guys gonna do the marking?" And we're like, who are we gonna mark it for? I mean, this is a breast. You know? So we went in the workshop, and then lo and behold, the models. But so we did the marking, and then they also teach us some about the ultrasound, which was very good. And then the last day, Saturday, we actually we actually performed the surgery. So we went to the medical center. There was again 24 of us. There was 12 patients. Each patient had 3 surgeons, one which was a Costa Rican surgeon, which actually the patient was his patient. And there was 2 surgeons from US. So then the Costa Rican surgeon basically kind of guided us, but I did one part at one side of the breast, and the other American surgeon did the other side of the breast. So it was kind of cool. And the Costa Rican surgeon was us. Actually, we got really lucky. Ours was great. He was very to the point, no wasting time. And it was great. It was truly amazing. And then after that, we went to and then we saw how the actual implants, ergo and round, they made.
Oh,
so
wow.
we went to the almost like it's kind of like a factory. How they actually made them from the beginning. How they molded, how they create a barrier, how they wrap it. It was amazing. It was really cool. But let's go back to the Preservé. So Preservé is basically it's a less invasive breast augmentation, but when I say less invasive, I don't mean necessarily the incision, because the incision they use for Preservé is a 3 centimeter, which I use the same for my traditional breast augmentation. It's more meaning like they preserve the breast tissue. That's correct. So less invasive, preserve the breast tissue, preserve the breast ligament, preserve the muscle. So the Preservé is done only through subglandular pocket. If you are a candidate only for a submuscular, or if you're interested in submuscular, then Preservé is not the operation for you. It uses only ergonomics. So do you guys remember there are 2 type of implants that Motiva has? One is ergonomics, one is round. The round is the one that gives you all the upper pole fullness. Well, you guys know that because you guys talk to the patient. And then ergonomics is the one that the gel is softer. It kind of embedded in your breast tissue, and it gives you the most natural look. It's like when you're standing up, it gives you a teardrop shape. When you lay down, it flattens. It kind of become part of your breast. So Preservé, we can only do Preservé with the ergonomics, and the maximum size is about 300 cc's. So, but I know what you're thinking now, because this is what the Thursday, the dinner before Friday, we all were talking about how are we going to do this. All the surgeons, we were saying like half of our patient using like 350, 400 cc implant. The 300 cc implant in Preservé, it looks a lot different than when you put in a 300 cc in a traditional breast augmentation, and I'm going to go over with that. The other thing that I truly like about Preservé is like you can now create a precise pocket. You can place volume, but actual volume is needed. I think the comparison that I like to make is about when we did liposuction 20 years ago. How did we did it? We just went in there and we just take the fat out. We just deflated everything, right? That's what we were doing back in 15, 20 years ago until Alfredo Hoyos came in from Colombia, and he taught us how to do a high definition liposuction. And that revolutionized the practice of liposuction, because he said you don't have to take everything out. You can actually leave certain fat in certain areas, and you should take fat from other areas, some areas more, some areas less, to create the natural anatomical aesthetic units, whether you're doing an abdomen, your back, your arms. So that was a key. That was a key part, right? Because and now liposuction became the fact that not just removing fat is actually creating shape. Bringing back the shape that you already had, or creating shape. However, you have to be a candidate for the high definition liposuction, and the same thing with Preservé. I think if you want to compare Preservé to traditional, that's pretty much what it is. It's again, it allows you to create a very, very precise pocket and put volume, but actual volume needed. I'm going to explain that to you how that means, because anatomically you have to be a candidate, which I'm going to go over that later. But Preservé is for someone that comes in, wants to have a very, very natural look, already have a nice shaped breast, but just want to have volume, a little bit more volume, like 100 to 200 cc volume, just in the upper pole fullness. You can do that. You cannot do that in the traditional way. You can place the 200 cc in a traditional way and give her the look that she wants. And I'm going to explain to you why. Imagine my hand is a breast, so this person only wants volume up here, right? If you do it traditionally, you have to open the pocket. So when we create a pocket, we're opening all these attachments. So now no longer the breast looks like this. It looks like a little bit of pancake. And then you have to put an implant to augment it. But if you're putting a small size implant, it's not going to give her the look that you want, because you are already detaching all these attachments. So you have to put a bigger implant to compensate for the attachment that you already detached. Does that make sense? Preservé doesn't do that. So Preservé, it keeps all the attachment medially, all the attachment inferiorly, all the attachment laterally, some of the attachments superiorly, depending on where you want to put the implant, because now you have a choice, and only take some of the attachment out medially, which is exactly what you want the implant to be. So now you can, in that same patient, you can place a 150, 200 cc implant, and it's going to look amazing. The case that we did, actually, Tori, was 200 cc 205 mini. I've never done a mini. I mean, I don't even have a consignment for a mini. And this is not just me. This is all the surgeons. We either do demi or full. And it looked like that patient had 350, 400 cc full round implants.
Yeah.
It was amazing, because now you keep all the attachment to the breast tissue, all the volume that breast already had. That's what I'm saying. This comparison to the high definition liposuction. You kept the entire attachment, you kept everything intact, and only added where it needs to be added on. The other thing is, like in this case, you don't have to do an internal bra, because you're not releasing any of the attachment. You don't have to do that. You still use the Keller funnel, obviously, to place the implant in. And the other advantage is the recovery is a lot faster. I mean, they were telling me like they can go have dinner the same night they have a surgery. They can go have dinner. They can go back to the gym in 2 weeks. So it's really different. The other thing was mentioning was anesthesia. So I mean, that they said basically that depends on your practice. You don't necessarily have to have a general anesthesia, but they recommend it. They say if you're doing everything under general, maybe in the beginning you should do that. You should keep doing what you were doing before. But yes, the procedure can be done under sedation or even local. So there is obviously, to do this procedure, it requires a certain kit, for it to do it. We need the dilator, and we need the basically there is almost like a saline implant, which kind of expand the pocket that you want to send, but it's very direct. So when you put this saline implant in there, when you blow it up, it blows up basically three-dimensionally everywhere to the breast. But that one, you can actually guide it exactly where you want to expand the pocket. So it's actually really cool. I'm very excited. I can't wait to do our first surgery. I think we already have a few consult patients that are booked for Preservé. The only key is, again, like I said, you have to be a candidate anatomically. And if you're here to place, if you're looking for the look to have kind of like an ultra high look, or kind of like a look that, hey, when you walk in the room, everyone knows you have an augmentation, you want, then Preservé for sure is not for you. We gotta stick to the traditional. Again, this is for someone to have a very natural look, have already a nice shaped breast, but it wants just a little bit up, a little bit more fullness, and keep the same look that she has. Yeah.
Cool. Thank you.
Yeah.
I'm excited for you.
Super excited. So if you if you haven't subscribed to us, please do. Please leave a comment. Let me know what I want to talk about. Ask any questions about if you have anything about Preservé, and give us a like. Okay. And once we get their first surgery, I'm definitely gonna make a video of that about you guys too. All right. Perfect.
Yay.
Thanks.
Thanks for joining us for Sculpted and Unscripted with Dr. Azad. Join us next time for another exciting episode.